Now, before we get up and move, you've brought your little blue toy with you today, so you better tell us what this little blue toy is all about before we go from...
Yeah, this is, I was struggling to remember the name of the company, but Activforce.
Activforce, right.
I think they'll kill me if I've got it wrong.
Well, we'll find out and we'll send that out after.
So this is a thing called a handheld dynamometer, and you can Bluetooth it with your phone, and you can use it for measuring muscle resistance, so you get some data, but it also does range of movement on joints, so you can put it on a joint and move it. So it gives you objective data, and it's very easy to use. It's not expensive. I think this is about £400,
right?
Which, considering its capabilities, is actually quite good. And I can give you can give the details of where to get it from.
Sure.
But the thing about this is that it's really great when you've got runners, particularly when they're enthusiastic club runners, and you've got some baseline data, because you can also do this pre-season. I mean, quite often I just test people, irrespective if they've got any symptoms. They come for a checkup, and I do testing. So we've got a base level, and then if they've got any injuries, we've got some data. So it's quite useful, and it's very versatile. I used to work in a clinic years ago where we had these big King Kong fixed machines, and the one we used was called a Cybex 340, great big clunky thing. Yeah. The problem with those is they're very fixed range of movements, and the beauty of this is you've got adaptability. You can do mid-range, end-range.
So if you were going to test your hip flexors with that, let's just make up something that you might want to do. There's a bit that presses on the leg, and
you basically hold on to that, and you're pushing this against, and you're getting the patient or the runner to push against you for however long you want, 5 seconds or so, 10 seconds, and then you can do, in the case of the hip flexor, you could do it full range or mid-range or end range, and probably do it on the end of the table.
I do like things like this because they give you a much more objective answer than the sort of rather random muscle testing that we do just by eye and feel.
You can't remember what you did last time, and you go, oh, that feels better than last time. You've got no idea, and the patient.
And I suspect the patient's more satisfied that they've got.
The patients love it because they know that you've got objective data. And you can say, oh, look, your strength has improved by 10%. And these are the figures. And because you Bluetooth it to your phone, you can then print it off. And that's really useful for the patients. So it's great.